Hello everyone, Dr. Hassaan Tohid here with a very good session, live question answer session. So let's begin. Let me invite all of you who are willing to join this session. So as you know, I spent first couple of minutes always inviting people. So let's see if you guys are here. Let's see how many people join. And please be ready with your questions and a notebook or a journal, something like that, because we are going to discuss something really important today and something very, very interesting. And when you are here, please do let me know. Please type so I know you are here. And feel free to ask any question. And also, I welcome all the new admissions who have just joined, and we will discuss that as well. And I'm waiting for all of you to join. Let's see how many people joined today. Okay, I can see now all of you. I can see the messages. Let me greet all of you with names. Okay, just allow me to do that. Give me one more minute and I'll be all set. Thank you, Aditi. Thanks a lot for joining us today. And thank you, Shweta, Travis. Thanks a lot. Thank you, guys. Thanks a lot. It motivates me to keep doing sessions when you guys attend the session, when I see the motivation. So now let's talk about everyone's situation first. And I'll talk to all of you. So let's start with Aditi. Aditi, which group are you and where are you with your paper so far? And what is bothering you? First, we will handle personalized questions, personalized challenges, and then we will talk about a general topic of topic selection that's I am planning to discuss today because one of my students he sent me a message that topic selection is something that he's struggling with, and he also told me that some other students also struggled with topic selection. So guys, the point is that if you struggle with something, tell us. Why do I have to hear from other students? Why not directly? You all have my number. You all have my number. You all have your faculty, your teachers, your mentors number. So why don't you just feel free to send us a text message? We are here for you. Okay, so I'm going to now respond to all of you. And thank you, Safina, for joining. All the new admissions, congratulations on enrolling. All the new admissions, congratulations on enrolling. And your classes will begin this weekend, highly likely. And this is the first session, this kind of orientation session for all of you. I wanted to welcome all of you and let you know that we are starting your classes this weekend. So be ready for this weekend. And also make sure you create an account on the app. Will give you the details. Must have an app. Everyone should have an app. And you guys will attend live question answer sessions with me each week, and you guys will also attend the live sessions with your mentor, and you will also attend the student discussion session, and you will also attend the statistics classes that now we have arranged for all of you. And I think we have a class tomorrow. Did we have a class last week for statistics? So that's the plan. This is how you will do my classes, my live sessions, and the statistics class. It's up to you if you want to attend it. But of course, if you attend it, you will learn more, because I try to keep everything new in my classes. Okay, so so you haven't received the membership card and everything. Okay, so I'll check it right now and get back to you. Where exactly are you? Mm-hmm. Hold on, you are in February group. Yeah, I can see you are already in the group and you have taken the classes too. So you have, yeah, everything is good. But all those new admissions, yes, you will receive a membership card and all the details. Don't worry about it. Just stay and be patient. You will get the membership card. Don't worry about it. You just told me, so you will receive it. And do you have the access of the videos on the app? Do you have the access of the videos on the app? So everyone, please remember, besides the live classes, when you miss the class, you will have the recordings to watch. That's always available. But you also have a lot of videos on the app. We have given you the app and you can watch the videos there. Because guys, the goal is not just to learn to write this one particular paper, but everything about research as much as we can, as much as you do, as much as possible. That's what the goal is. Okay, so that's what the goal is. Now remember, you can never be perfect in any field. You can never say I'm 100% knowledgeable about research, but what you can do is you can become excellent. And there is no perfection, but there is excellence. You can keep learning and growing more and more. Do you think I know everything? No, nobody knows everything. Nobody in the world can claim I know everything. The one who claims that he knows everything is the biggest ignorant person, unfortunately. So even I don't know everything. I keep studying. I always taking courses, always studying, because I don't know everything. So that's the attitude I want for all of you. This is the attitude you should all develop, that keep learning and take the full advantage of this course as much as you can, because we have created this course with immense effort, with immense struggle, with so much of knowledge and so much of experience. We have compiled everything. So you will learn so many things on the app, on videos that we have given to you, and we have also given you some certificate courses. I don't know if you know about that. Besides the videos that you will get, you will also have some certificate courses, and I recommend that all of you finish it, because we discussed yesterday that your value increases if you have more and more courses on your CV. You will not get this opportunity again. You only have 6 months, most of you. So now what are we going to do? Let me talk to everyone else and see where exactly everyone stands. Mafaz, where are you with your paper? Can I know everything? And Shweta, where exactly do you stand with your paper? Have you all started your classes already? And how many of you are applying for general surgery? Do let me know as well. Okay, you discussed with me yesterday, Mafaz, if I remember. Oh, yes, yes. Okay, very good, very good. Yeah, I discussed that with you. So we will continue. This topic is my favorite topic that you're working on. Okay, who else? Who else? Shweta, where exactly? Okay, I'm doing quality appraisal for my article. My question at not to have comparison group for systematic review. My inclusion group is only children. That's fine, because if you bring a comparison group, it will become statistical. It will become meta-analysis. You try to stay away from meta-analysis for now, because you need to have a paper done as soon as possible and have it published. That's the most important thing. And learning the strategy, the search strategy, and the methodology of systematic review makes you invincible, because not everyone can do it. Systematic review is not that easy. If you are already at quality appraisal, that means you have already learned the methodology of systematic review. Samia, very good, very good. So you all are almost there. Now it's time to start writing. So do it and don't delay. If you already have collected data, you can sit on your dining table and start doing it today. You can finish it by tomorrow. To be very honest, I'm not kidding. If you just give 100% attention and focus to your work, no other task, and say, I will not leave until I'm done, you can do it in a few days. And you have done it before. You have done difficult, way more difficult topics, way more difficult jobs before, like for example writing essays and long answers to questions when you were kids, and in the examination hall you used to write huge humongous amount of detail in examinations. And remember that the more you wrote, the better your scores were. So you are habitual of writing long. You just lost it in between because of the medical school, but you have done it when you were young. And that's why, when we have younger students who are high school students, they tend to perform better in this training than medical graduates. Why? Because they are habitual of doing homework. That's the that's the strange phenomena that we have noticed. So I would like all of you to imagine that you are in a school right now, and you have a homework every week that you have to complete. Just change the attitude and see, you will finish it. Okay, so Samia has a question. If I say I have reviewed 100 articles in method, um, is it necessary that I reference all of them? No, whatever you included, only those articles will be referenced. You initially reviewed 100 papers, then you also did screening, right? You did screening, and then you did the abstract and title screening, and then you did the second screening of full text. Once that was done, then you did the quality appraisal. Then when you did the quality appraisal, then you also excluded some papers. So whatever the final number is, that's the main number of references that you will keep, and they will only be mentioned in the discussion section, those references, because in the introduction section you may have those references that were not in your paper at all. Because introduction information is just statistical information, some background information. I usually cite my introduction from Wikipedia articles or some other articles. Those are not in my data. Introduction is a different story. It can also be from your data, that's fine, but it may not be from your data. Make sense? Okay, and somebody asked me a question today, that yesterday I discussed that if you want to become more valuable and be more competitive for residency. I know it's out of topic, but I just want to answer this question because I said I'll discuss that during the class. So remember, I said yes, you create blog posts and YouTube videos, so that you become more competitive for the residency match, and you have more value than others, and you can show this to residency directors, that how committed you are to the field of medicine. So whatever field of medicine you are interested, if you are in psychiatry, you are in neurology, if you are in internal medicine or gynecology, pediatrics, anesthesiology, just create a YouTube channel of that specialty and discuss one disease in one video per week, and you will see that you will have something else to show on your application in the residency match that nobody else does. I don't know why people don't take action. Majority of people don't take action because of fear and because of lack of belief. That they don't believe that things will happen, they will be successful. So the question was, can I do that in my own language? Spanish, French, Hindi, Urdu, Arabic. Absolutely. Do it. Blogs, can I do that in my own language? Absolutely. But I would suggest if you write a blog in your own language, just put that blog on Google Translator. Also convert that into English language so you will have both. Google Translator is quite accurate. And before submitting, publishing, you say you write the blog in the same, let's say a blog in Spanish on depression or anxiety, and you have that topic and you have that in Spanish. Now you convert that on Google Translator, and now you also have a blog in English language. So those, they become two blogs, one in Spanish, one in English, but you will count it as one because that's the same thing. But now before publishing it on your blog website, you just make sure you hire an editor or check it on Grammarly. Does it have any grammatical errors? Or Turnitin or any other website, or just hire an editor who will just check the English errors and mistakes of your English language. And the same goes for if you are writing in English, not in any other language. Your primary blog website is in English language. You still seek the help of a professional editor and proofreader to avoid grammatical mistakes. I would suggest do it both ways. But if you're comfortable talking in English and you want to do a Spanish channel, está bien. Why not? So that's what I wanted to discuss. And I also wanted to discuss, this question was brought to me yesterday, that should I take admission in masters or not, or should I do everything else that you mentioned yesterday? So I would say take admission and do everything I told you. Then when you apply for residency, you will show this to the residency directors that I'm already enrolled in masters or PhD, and that will help. They will be impressed, they will be happy to see that. And then the choice is yours, that when you get residency, whether drop out or continue. So many people drop out because their ultimate goal was residency, so they drop out from masters. Their purpose was fulfilled. If not, you want to continue, you prolong your admission and tell the university that I am in residency, so I will be giving less time, so I want to finish that in more time than usual. So they will allow that. Universities have no problem with that. So you gradually do that, finish it. So you have both options. You can drop out once you get residency, or you continue and prolong it a little bit and finish it. And if you, God forbid, again don't match, then just complete your masters and see the difference and all the things I mentioned. And why doesn't anyone think of book chapter writing? Book chapter is a king. Why don't you think of writing a book? So many residency candidates I have seen, some unique candidates who write ebooks or books. They have published books through Amazon when they apply for residency in their specialty of their own choice. One of my seniors, he wrote a book on pharmacology so many years ago. When he applied for the residency match, he showed that to the residency directors. Pharmacology. He loved pharmacology, so he just wrote a book, short book. Don't have to write a long book, short book. Think out of the box. Do what others haven't done. For God's sake. Don't follow the crowd. Don't follow the follower. Create your own destiny. And speaking skills, regarding interview, we discussed yesterday, speaking skills you can improve by taking admission in Toastmasters. Toastmasters is amazing. They will teach you how to talk. Your whole confidence level and personality will change because of Toastmasters. They will teach you how to talk. Do you think I was this kind of speaker before? No, I was not. I learned it. I practiced it. I joined Toastmasters. That's how I did it. It depends how serious you are, and they are so economical. So economical, you will be astonished to see how economical they are because they are non-profit. So let's come back to the topic of research. So question 2, from the articles which I have screened, is there a way to categorize all the respective studies in one category to do quality check? All RCTs together, all systematic studies. This is exactly how we do it. This is exactly how we do it. Because then you know that this assessment tool, the Cochrane risk of bias assessment tool, is for clinical trials. So I just quickly skim through all the clinical trials that are together mentioned in one sequence in a chart. You're done. Then all the Newcastle Ottawa scale studies, that will be observational studies, all the observational studies together. And by the way, do you know that non-randomized control trial, you check the quality by which tool? Newcastle Ottawa scale. Newcastle Ottawa scale is not only for clinical trials. For observational studies, sorry. Newcastle Ottawa scale, many people think it's only for observational studies. No, Newcastle Ottawa scale is for observational studies and non-randomized control trial. For randomized, we have Cochrane risk of bias assessment tool and other tools. And many people are stuck, oh, I cannot understand the quality appraisal tool. If you don't understand a question, cross it. That's fine. You just need majority of yeses. If you cannot find the answer of a question in a paper, that means this topic was not discussed. So it's a no. Okay. So now the next question, when I'm applying for research position or physician assistant positions, they need commitment like I can't go attend rotations and take a break to give my step 2. If somebody has this kind of condition, I will look for other position. Or I will take this position and I will do my research and write my papers after the job hours. And I'll try to find a rotation on the weekends. Again, you don't want to do work 7 days a week. For so many years of my life, I did 7 days a week. I still do 7 days a week. I don't think there's any day I take off unless I'm on vacation. Because I love it. Not because I'm a hardworking person. I love it. I don't get tired. That's why finding passion is important. You don't get tired. I'm not exaggerating. I know somebody will say, oh, he's exaggerating. Oh, he is just lying. How can somebody not get tired? If you live a life of passion, anyone who is living a life of passion will give the testimony that he's right. People who live with passion, they rarely get tired unless they are really sick. They enjoy doing it, so they can do every day. So if you love your field, you do 5 days a week, job in research in the field of your choice, and the rest of the 2 days you do rotation or you do research writing or you take courses. But don't waste Saturdays and Sundays. Don't waste Saturdays and Sundays. Time is limited. Take Saturdays and Sundays off after you achieve your goal. Until I achieve my goal, I rarely take a day off unless it was highly necessary. But even that day, I remember I was working. Okay, now the question in meta-analysis, if I do have only 9 studies, can I do funnel plot? If not, how I can assess risk of bias? Yeah, you can do that. Risk of bias you will do before when checking the quality. I have question 2. I just got enrolled today. For someone who has no prior experience in research, would this course be enough to learn everything from scratch? Yes, that's a very good question, Safina. Today, I'm also talking to students like you who have just enrolled and have not done anything before. But I'm also talking to majority of those students who are already enrolled and they are finishing their course, or some others who have already finished their course. So that's why few terminologies that I am using right now are difficult for you to understand. But don't worry about it. When your classes begin, you will start from the very, very basic, from very, very beginning. This training is for absolute beginners. From what is research? And let's do some highlights today. I'll do that. Don't worry about it. I'll make concept clear for all of you. Remember, guys, the greatest thing you can do for your future career for research is knowing all the study designs. If you know all study designs, you can differentiate between different kinds of studies. You know research. That's all it is. And it is easy. It's not difficult. I'll tell you how it is, how easy it is. I'll make you proficient in that topic, in that subject, how to differentiate between different kind of studies. We'll do that. Please clear this confusion. There are two big hospitals in my city and they don't offer official rotation. So can I ask the physician for rotation? It depends on the rule. Ask the physician if he has permission by the hospital to do that. And what field do you want it? I just enrolled today also. How can I get access to everything and to the app? Wait for my message on the group. You will get all the details. And when will be the first class? This weekend. We're trying to start your classes this weekend. If something happens for some reason, then definitely next weekend. Can you tell a bit more about the process from now on for the new ones? Yes, just listen to me today, what I'm saying, and stay in touch with me on WhatsApp and with your faculty member, your mentor, who will be your mentor of the class. I will introduce you to your mentor. I will add him or her on the group, and then you will be able to communicate and you will be given the schedule. And possibly your class will be Saturday or Sunday, and the Zoom link will be shared before the class. You attend the class, do the homework that will be told to you to do, and finish that homework that week and meet with the mentor next week in the class. During the class time, during the week, if you have any question, you just get back to me. You have my number. Just text me, text your mentor, text other faculty members. We will introduce you to other members as well. So you have so many people to contact, and we will try to get back to you the same day. And you will also have my live question answer session every week to avoid this kind of confusion if somebody has confusion. And what else? And you will have the live student discussion sessions because you are co-authoring with each other. So make sure you collaborate with each other. That's why we have student discussion sessions. You cannot co-author with anyone without collaborating. It's unethical. You need to collaborate as team and work on each other's papers to justify the co-authorship. That's why these sessions are important. Now, the third thing is, that's the most important thing, is the statistics classes. We have added a new statistics classes to this training program, and those are optional for you. But if you want to learn and excel more on research, then you will learn everything about statistics for research during this training, and you will get an extra certificate of of statistics for research as well. You are, once you graduate, you are going to have so many certificates to mention and to brag about on your CV. That's the benefit of this course. I don't mention that. I want to keep it a surprise. So I want to surprise when the students enroll, and then they see, oh wow, we enrolled for be a published author program, but we got so many certificate courses too. That's what I like to do. Okay, so now the question is, I can take rotations in cardio pulmo, and I know many physicians personally as friends. The hospital doesn't offer it, but if physician asks the hospital admin to get me in, will it work? Absolutely, why not? So ask the physician if it's allowed by their hospital. If it's not allowed, they will not be able to do that. If it's allowed, they will have no problem. Okay, hi Feroza, how are you? And you guys can also join me in my clinical rotations, tele rotations with my patients. If you want to learn psychotherapy, anyone who is interested in psychiatry. I have some patients, and I do that treatment through tele-rotations, tele-counseling, tele-psychotherapy. Okay, so now, oh, Shafat, hi, how are you? So that's the thing, guys. Try to get as much experience as possible, as many places as possible. Some will be lesser of diamonds, some will be huge diamonds. There will be people who will say private practice rotations don't count. No, no, no. They will be valued lesser in comparison to a residency program, in-person rotation, okay, but they will not be considered as zero. You cannot say it's nothing. Yes, yes, absolutely. I have my patients. And if you're interested in psychiatry residency and you want to learn different kinds of psychotherapies, how we do psychotherapy, how do we treat patients, how do we help them with drug addiction? And addiction is a field of psychiatry. So that's the thing I'm going to tell you, that don't ever listen to people who will say, oh, in your neighborhood there is a private practice, oh, don't do rotation over there, do it at a residency program. These people just don't understand. It's not easy to find these rotations. It's not easy to find those rotations. So whatever you get, just get it. You don't have time. If you keep up, just get that clinic, that get private practice near your office, your home. Just do it, and meanwhile keep applying for other positions. And if you get it at a residency program, nothing can be better than that. Go leave that person now and go to the residency director or residency program chief resident, because you need to work in the environment of the hospital where they have residency program and know the people out there. When they know you, they like you, then they will invite you for interview for sure. So yes, that will be your priority, but don't waste time. Biggest mistake people do is, oh, I didn't find rotation, I was trying to find rotation, that's why I'm sitting home. Nothing can be worse than sitting home not doing anything, just applying for positions. No. If you get a position at a nearby private practice, at a nearby hospital, go do it rather than wasting time. You still learn something. You still learn so many things. And as I told you, there are some diamonds that are not visible on your CV. They are visible in your personality when you learn a new skill. When you learn psychotherapy, for example, it is visible in your skill, in your personality. It is not visible on your CV, but actually it is also visible on your CV too. You can mention in the skills, cognitive behavioral therapy, motivational interviewing, reality therapy, all those kind of therapies. So there's always benefits and benefit. I mean, there's nothing to lose. One thing I learned in my life was, guys, that education is never wasted. Somebody asked me, can I take these courses? I don't know if these courses are good. Remember, take any course as you like, as you want, any course, any company, any organization, because you need to not waste any single day and keep adding more and more courses and certificates on your CV. Not a single day should be wasted. Some courses will be lesser diamonds, but some courses will be more diamonds. But diamond is a diamond. And the biggest diamond is that is not visible, that you learned, that the knowledge you absorb, that is reflected in your personality. That's the biggest diamond. If you're not passionate about neurology and you're doing neurology, quit it right now. Find your passion. Find the purpose of your life. Otherwise, you cannot become a good neurologist. You can actually do disservice to your patients rather than serving them. You can only serve people when you love it, when you love the field. This kind of excitement will be visible on your face and your patients will see it. But if you don't like it, you will be stressed out like this. You will be angry. You will be yelling at your patients. You will be doing disservice. And you can damage their health. And how long money can motivate you to keep a job? No. Only the love of the field can motivate you to keep the job. Love cannot, the money cannot keep you motivated. Never, ever. Make sense? So now, in medicine, there are so many fields. Think about it and switch it. What in medicine do you like? Medicine is one of those great fields in the world that you have so many options. If you don't like neurology, you try psychiatry. If you don't like psychiatry, try gynecology, try obstetrics. If you don't like any of those, try pediatrics. If you don't like pediatrics, try internal medicine. And internal medicine has so many branches. Cardiology, try cardiology, try GI. Let me tell you, if I were not in mental health, guys, I would have been a rheumatologist. I love bones. I love um, rheumatology. I love the diseases related to rheumatology, like osteoarthritis, septic arthritis. I love these things. Rheumatoid arthritis, I love it. And my exam questions never went wrong when it was a question of rheumatology. I love it that much. So if I were not in a mental health field, I would have been a rheumatologist, or I would have been a hepatologist. I love liver so much. So these were my top three always. So you medicine has so many branches that you always will find two or three fields that you love the most. So mental health, rheumatology, and hepatology. I love them all. But mental health, I was way more into mental health than anything else. And my knowledge was more in mental health. I was passionate about this more than anything else. If I would not have been in this field, then I would definitely be doing these two. But they will be my second or third option. And I would have survived, but I would not have been living the best life I have because of this mental health field that I have. So think about it. Medicine has so many options. You have endocrinology. Endocrinology has so many options. Diabetes. For the rest of your life, you can just keep dealing with diabetic patients. Okay, I'm looking for more research article writing opportunities remotely and sending emails to professors, but hardly getting a reply. Of course, you will not get a reply easily. Out of every 100 emails, you will get one reply. And why don't you contact the professors on their LinkedIn? People reply to LinkedIn faster than they reply to email nowadays. Okay, and I will tell you how else you can get more papers. You can upgrade to 6 months of this training, CIBNP, and you can work on multiple papers. That's another opportunity. And why don't you start your blog writing? I've been telling this again and again. Nobody does that. I don't know. I don't know why people don't listen to me. And I have a very good news coming up very soon for all of you. I'll announce, possibly next week. I'll announce it. Let's see. So many people say I'm starting, they never started. And if they do, they will stop it after one or two blocks. Not everyone can do it. Only people who are passionate about it can do it. Let's see if you are really the one. Now that step one, pass and fail, do you think program directors will gonna pay attention to the score to these applications, to those applicants that did their step one exam before 2022 and have numeric code? Nobody knows the answer to this question, unfortunately. They should not, but how can they avoid not looking at your scores? That's the thing. How can they not? So ideally, I wish, I pray that they don't. And now because there's no score, so they should just look at pass and fail and they rely on step two scores and the number of publications, because that's what we are expecting. They will be looking at number of publications and they will be looking at step two scores, because there's no step one score. So these are the two numbers they will be looking at, because you need some number to measure. So hopefully they will not look at that. But nobody, the real answer is nobody knows the answer to this question. We don't know yet. Let's see what happens in this match. Okay, so anyone else has any question? Anyone else has any question? Just 1 month of clinical rotation and 10 to 15 research publications will be good enough for the match. Nothing is good enough for the match. Try to do as much as possible. Why just 1 month? Why can't you do 6 months? You have 6 months now. Why can't you do, instead of 10 to 15 research publications, increase the goal to 20 plus? Write short papers, write the letter to the editor. Doesn't matter, not all the papers should be in the top journals or the even the PubMed index journal. Try to increase the number of papers and create the value. So the question is that in the app, you watch the course Life and Career Management, but it's still saying incomplete in the app. Ignore it. You will be able to download the certificate still. Ignore that incomplete sign. I don't know why it's happening. I'll talk to the team and see what happens. Okay. But I hope that session helped. That was one of the best sessions I had. I think better than yesterday. How was yesterday's session? Did you guys really enjoy? Did you guys really feel that that really was a life-changing session? The the only thing is that if you take an action, nothing will happen. Until you take an action, nothing will happen. So many people listen to so many things, but they don't take an action. They say they will do it, but they don't take an action. So that's why I'm saying, until I see the results, I won't believe that you are taking action. That's the only difference between successful people and unsuccessful people. Successful people take decision. Everyone knows what is right and wrong. Everyone knows how to succeed. Everyone knows. You just need a reminder. You knew all these things that I told yesterday. I didn't tell you a new secret. There is no new secret of life. There's no new secret of success. These things are already there. But only few people take action. Please discuss how many types of publications can we write. Okay, so let's talk about this. First of all, start with the very basic. So research, everyone knows what is research, right? Everyone knows what is research. Looking for an answer is research. Finding an answer, searching an answer, finding a solution is research. Quest of knowledge is research. All of these are definitions of the word research. Now, research, when scientists started to do research, they developed certain kinds of research. And the word researches is incorrect according to grammar experts. I'm not a grammar expert though, but I heard that this is not a good way to say researches. You say pieces of research or studies of research. Same like evidence. There's nothing as evidences. Thank you, Shafat. Thank you. So coming back to the point of different kinds of research. So they noticed that some researchers used animals, some researchers just used the cells, animal cells or human cells. Some researchers, they just did the survey questions. Some researchers gave medication to somebody and they did research. Some researchers did something else and something else and something else. So a new student like you is confused. What is research then? Guys, all of these are different kinds of research. So everyone now do one thing. Go on Google right now, everyone, leave this video here, go on Google and type study design pyramid and go to the images. Study design pyramid. Let me show you something. Study design pyramid. And I'm talking to those students who are attending their first session today. Who are in their first session today. Study design pyramid. Did you guys see that? Did everyone open study design pyramid and open the most colorful diagram that you can find? Study design pyramid. Study design pyramid. Okay, So what do you see on study design pyramid? You see some names mentioned at the bottom, and you see some names mentioned on the top. What are those? That's it. This is the research world. So everyone who is starting their research training right now, I'm telling you the greatest secret of research. There's nothing else left in research. That's it. Whatever is mentioned in study design pyramid, these are the kinds of studies you have. Congratulations, only 9 kinds of studies, or maximum you can say 14 types of studies. That's it. And people say research is so difficult, I'm so confused, I don't know how to do research, how to find the knowledge about research. There are so many books and difficult terminologies. When I open a book on research, I sleep. Because most people who are teaching research, I have noticed, many people, I don't say most people, that's the wrong word to say. Many people who are teaching research, they themselves don't love research. And they will just read out what is written in the book. But the best teachers of research will tell you, best teachers of research will tell you that research is so easy. If you just look at the study design pyramid, you will see there are only 9 kinds of studies, and that's it for research. If you understand these 9 kinds of studies, you understand the whole world. In medicine, how many diseases do we have? Thousands of diseases, right? We have thousands and thousands of diseases, and you can never ever understand all the diseases. You can never ever learn all possible diseases in the world. But in research, we only have 9 kinds of studies. Research is the easiest thing in the world. First of all, change the mindset that research is difficult and boring. Research is the most interesting and lovely subject because we only have 9 kinds of studies. If you know these 9 kinds of studies, you are on the top of research world. Congratulations, that's it. Now let's look at the study design pyramid. So everyone who has opened the study design pyramid diagram, what is at the bottom? What is at the bottom of the pyramid? Yes, 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 Samia, we are going to discuss that. That's what I'm coming to. All kinds of publications, we'll talk about that. But first you need to understand different kinds of studies. Only then you will be able to understand different kinds of publications. What is at the bottom, everyone? Please tell me what is at the bottom. Hurry up, hurry up, hurry up. Very good. In vitro research is at the bottom. So in vitro research means, vitro is a Latin word. It means glass. And we also call it a test tube research. In vitro research is also known as test tube research because test tube is made of glass. In Spanish, glass is known as vidrio. Vidrio. And it's a quite similar word because Spanish has been evolved from Latin language. They all are known as Romance language. All 3 of them, French, English, and Spanish. They are known as Romance. French, Italian, and Spanish. They are known as Romance languages. They have been evolved from Latin. And you can also say English, right? But mainly French, Italian, and Spanish. So vitro means glass in Latin, and vidrio in Spanish is glass. So remember this now. So you will remember in vitro studies mean that there will be glass related research. That means there will be test tubes available in the lab, and people will be looking at test tubes. So when you see the researcher, just close your eyes and think of a researcher in a lab, where that's what comes to our mind when we see, or when we say, or when we hear the word researcher, or one day I'll be a researcher. The image that comes to your mind is that there is a doctor standing in a lab with so many glass apparatuses, and holding a test tube and pouring something from another bottle or something. Isn't it, isn't it a usual concept of a researcher? That's what we imagine, and that's what we have seen in the movies, that's what we have seen in the advertisements. The safeguard soap advertisement, toothpaste So everyone thinks that this is what a researcher does. No, this is one of the studies. This is not what the researcher does, and this is the weakest evidence. It is at the bottom of the study design pyramid. It is at the bottom. That means it is the weakest study design. And why it is weakest? Any study at the bottom means it has more chances of bias, and it is less relevant to human treatment. In vitro research is available in all fields: medicine, biology, any field in the world except engineering. You will not see that in engineering or finance, those fields. You will not have in vitro research. But in life sciences, when we talk about medicine, when we talk about psychology, when we talk about biology, when we talk about biomedical sciences, when we talk about biochemistry, anytime when we talk about in vitro research, remember first of all this: whenever we talk about in vitro research, it is not talking about human treatment. It is not relevant to human treatment, and it is the weakest evidence. That's why it is the weakest evidence, and it has more chances of bias. And in life sciences, whenever we talk about living beings, we will always have in vitro studies. But in engineering and finance studies, in finance fields, we will not have in vitro studies. We don't need them. So that's clear. You will not see that in other fields, but in medicine you will. Now, what's next after that? Animal studies. Now, animal studies, do you need animal studies in finances? No. Actually, yes. Neuroeconomics is a field. We'll talk about that. But what about engineering? Do we need animal studies in engineering? No. Do we need animal studies in psychology? Yes. Do we need animal studies in medicine? Absolutely. Everyone is clear now? Animal studies is the second weakest evidence. Why it's the second weakest evidence? Because it is less related to human treatment and it has chances of bias. Now, it has chances of bias. So now what's the most important thing about this? That it is still better than in vitro studies, because now a whole organism is involved rather than one cell. In vitro studies, only one cell or few cells were involved, or some test tubes were involved. Microbiology research. Microbiology is in vitro. Animal research is a little advanced than that. So these are two kinds of research. Now, what's after animal research? Ideas, opinions, and editorials. Yes, opinion article. Ideas, opinions, and editorial. And where do we keep the letter to the editor? Here. Ideas, opinions, editorials, because those are ideas, opinions, and editorials. They are also evidence, but they are still weak evidence. But they are better than in vitro and animal. And where do we collect data for in vitro studies? Everyone listen to me. Where do we collect data from in vitro studies? In the lab. Where do we collect data for animal studies? In the lab or in the field? If we are doing a study in a jungle with animals, if we are doing study on animals in a zoo, if we are doing study on animals in a park or anywhere else, yes, so wherever animals are present, we can do animal studies there, but they are also done in the lab. So that's how you collect the data, by observing animals or doing experiment on animals. So how did you collect data? You collected in the lab or in the field. In vitro studies, you collected data in the lab only. In animal studies, you do not collect data in the lab only. You can collect it in the jungle. Make sense? This concept is clear? So easy? You can collect data in the zoo. So now, remember, whenever we collect data in a lab or in the field or in a jungle, just like this kind of thing, we conduct a study. We call it as empirical evidence. Empirical evidence. You must have heard this word, empirical evidence. Empirical evidence. What does that mean? It means somebody conducted a study, and it was an empirical evidence. Okay. Now, ideas opinion editorial is not an empirical evidence. It's theoretical evidence. Everyone is clear now? Because you don't collect data of ideas, opinions, and editorial in the lab. Where do you collect data from? From your mind. If I'm writing an editorial, I have written editorials. So when I'm writing an editorial, where do I find it? The data. It's in my mind, with my experience. With my mind, with my experience. No, Shweta. Primary data is empirical evidence. Somebody doing something in the lab. That's primary data. Empirical evidence. Expert opinion, the ideas, opinions, editorial is a secondary data. Or it could be primary data that I conducted a research initially 10 years ago, and now I'm writing my opinion about my own study. So that can be said that yes, okay, it is a primary data, but technically it is secondary research. Is that concept clear? And remember, I'm talking to absolute beginners. I want to make sure before you start your classes, you have this concept extremely cleared. Nobody will ever teach you research from this basics. Never, ever. That's why we are proud to say that CIBNP is the best. We are number one. We will teach you everything from the absolute basic, absolute beginning. Nobody else will do that. People unfortunately assume that the students already know everything. No, you don't know everything. That's why you are learning from the very basic, from the very beginning. Wow, what was that? Somebody threw a ball. Soccer ball. So anyways, so let's talk about this. In vitro studies, weakest evidence, empirical evidence. Done in the lab. Animal studies, empirical evidence. Second weakest, not the weakest in all studies, but second weakest. And empirical evidence done in the lab or in the field, in the zoo, in the jungle. Ideas, opinions, editorial, not an empirical evidence. You're not doing anything in the lab. This concept is clear. Then comes the case reports and case series. Case reports is, what is case report? When you are studying one patient or from 1 to 4 patients. If you are studying from one, there is a huge disagreement among the scientists that how many patients should we consider if we are writing a case study, and how many should be case series. So remember, most scientists unanimously agreed upon one number. I would say most scientists, but there's still a disagreement. So remember my formula, because I agree on this one. This is my formula. If you have 1 to 4 patients, it's case report. If you are studying 1 to 4 case, 1 patient or 2 patients or 3 patients or 4 patients in one paper, that is a case study. If it's more than 4, it's a case series. Up to 10. 4 to 10 is case series. So many people say, what is the difference between case series and case study? This is the main difference. Case study has up to 4 people, 4 patients, or 4 things. You can study anything. A case study can be in any field in the world. Any field in the world. Ideas, opinions, editorial can be in any field in the world. But in vitro and animal studies cannot be in all the fields. They are only related to living beings, life sciences, life sciences, life sciences. Case report can be done in engineering, can be done in finances, can be done in biochemistry, can be done in biology, can be done in any field in the world, physics, any field in the world. So case study, when you're studying up to 4 people, 1 to 4. Case series is when you're studying more than 4 people. And watch my YouTube videos on difference between case study and case series, because otherwise it will take a long time right now. So everyone, to understand the main difference between case series and case study, watch my YouTube video. I'll share that video with you. You should know how to differentiate between case series and case report Only few people in the world know this difference. I have discussed that very clearly. And if you still have confusion, get back to me. I'm here. Main identification feature is of both case report and case series that they are observational studies. You just observe, you don't do anything. In animal studies and in vitro, you observe. They can be observation studies, but they can also be they can also be experimental studies, because if you add something to the specimen that you have in the lab, if you add something to the cells, a medication, it becomes an experiment. If you give some injection to the mouse or the rat or the rabbit in the lab, it becomes an experiment. Now it's no more an observation study. If you're looking at animals in the jungle, it's observational studies. But if you give them food in the jungle and now you observe them, it's become an experiment. So animal studies can be experimental studies, they can be experiments. In vitro studies can be experiment. Case reports and series are just observational studies. If you give them intervention, they will be called as clinical trial. And case series, unique feature of case series, you only have one group. So watch that video. It is very important to understand the differences between different kinds of studies. If you know these 9 kinds of studies, you know everything about research, and research writing and paper writing will be a piece of cake for you. I'm telling you, just master these 9 studies. You know the difference between these 9 studies, and you can ace any question related to research in residency interview. If they ask you any question, you will know more than them. I'm telling you, because you are officially trained now. We will make you that person that if any question is thrown at you during the residency interview about research, you will be able to answer it very easily. You will surprise them. Now the next thing, after case report, what comes after case report and series? Cross-sectional studies. Then comes the case control studies. Then comes the cohort studies. These 3 C's: case, cross-sectional, case control, cohort. So let's talk about the cross-sectional studies. Whenever you have survey studies, when you give surveys to people and they answer those surveys and send back to you, what is that? Cross-sectional. Cross-sectional study, survey study. Cross-sectional means what is happening at one point in time. You're just looking at the prevalence. They are also known as prevalence studies. They're also known as snapshot. These are all the names for cross-sectional study: survey study, snapshot, prevalence study. But now one thing, cross-sectional actually means what is happening at one point in time. But if I do a survey multiple times in time, what do I call it? I don't call it a cross-sectional study. I call it longitudinal study. What is happening at multiple points in time? If I give survey multiple points in time, let's say I get a survey today by a university to participate in research, and I answer the survey, I send it back to them, or they send me a Survey Monkey website. You know that there's a website for cross-sectional studies, Survey Monkey. They do the survey. Sometimes you may get an email of Survey Monkey by a university or some organization that, could you please participate in this research? We'll pay you $50. So can you answer these questions? So you do the survey, they send you $50, and you send the data. But then they come back to you again in April and they say, can you do this survey now? This is the same study we are doing, but now we need another survey this month. What is that? You now don't call it a cross-sectional study. Now you call it longitudinal study. Although it is a survey study, it is a kind of cross-sectional, but because we did it multiple times, now we will call it as longitudinal study. So nobody should ever be confused now, from now onwards, what is longitudinal study and what is cross-sectional study. Now let's go to the next one. Case control studies. Case control studies are when you are studying a disease, when you have a patient, and you have 2 groups now. Now from here onwards, you will have 2 groups. After cross-sectional, you will have two groups. Although some studies do exist, cross-sectional studies where there are two groups, but rarely. But it is possible. But actually, two groups start after case control. So you have cases and controls. That means you have lung cancer patients and some patients who have some other disease like tuberculosis, or they are healthy. So you have cases and controls. Controls are healthy or they have some other disease. Controls are healthy or they have some other disease. Cases are the patients, so lung cancer patients. Now, what do you do in case control? You go into the past. Back to the Future movie, remember that? Sometimes they went into the past, sometimes they were in the present, sometimes they were in the future. This is what will happen here in observational studies. In cross-sectional, you look at the present, what is happening at one point in time. In longitudinal, you go into the future too. You do what is happening at multiple points in time. In case control, you go into the past. And how do you go into somebody's past? You take history. You ask questions. Did you smoke? Did you not smoke? And how else you can see the past? Electronic medical records, file medical records, paper medical records, everything, all the documents related to the patient in the hospital are the data that is taking you to the past. What happened to this patient a few years back? What has he been doing? His proper history. So you can collect data from the hospital where he is right now if the data has already been collected, if the history has already been taken, or you take the history, or you talk to the primary care physician of this patient, or you talk to whom? Or you talk to whom? You talk to his family. These are the four ways you collect data for case control study. You go into the past, you saw, okay, they were smoking. Okay, so those who smoked, 80% of them develop lung cancer. So now you can say lung cancer is associated with smoking. You found the risk factor. Here you did not know the risk factor, but you knew the disease. And your data collection, your sample collection was based on the disease. Now comes the next. What is after case control? Cohort studies. We have two kinds of cohorts now: prospective and retrospective. In one cohort you go into the future, in one cohort you go into the past. What do you study in the cohort study? You take healthy people and who are exposed by some risk factor, a population that is exposed to a risk factor, and you have a population that is unexposed. So you have two groups again: exposed and unexposed. Just like cases and control, here you will have exposed and unexposed group. And you will, let's say they are already smoking, so they are exposed, or they are living in a city where there is poisonous gas, or they live in a building where there is lead poisoning. So now they are already exposed, and you have another building where people are unexposed. So you will compare exposed versus unexposed, and you will go into the future, 6 months down the line, 10 months down the line, 1 year, 2 years, 3 years. Cohort studies, prospective, are so long that they can last for years. There is a study that started in 1940s and still going on right now. Can you believe that? They keep getting data every few years, and they are doing it generation after generation, and they are seeing what happened to the generation, the kids of these people, what happened to them. Cohort studies are that long, that time consuming, and they're expensive. Case control is short, inexpensive. You can do it right away. Now you go into the future, right? But that's called prospective cohort. Retrospective cohort is when you go into the past. Retrospective studies when you go into the past. How do you go into the past? Same thing like we did in case control. Now the problem is, what is the difference between case control and cohort? What is the difference between case control and retrospective cohort? Because in both we are going into the past. Remember, in case control, you knew the disease, you knew the patient, you collected the sample. Sample selection was done on the basis of disease. Here, the sample selection is done on the basis of risk factor. You know the disease, but you don't know, you know, sorry, you know the risk factor, but you don't know the disease. The opposite. That's the only difference. Here you are focusing on the risk factor, you are studying the risk factor, you don't know the disease in retrospective cohort. But in case control, you know the disease, you don't know the risk factor. You will ask questions and find out what the risk factor was, and then you will study the association, and you already have the patient with the disease has already happened. Here the disease has already happened too, but you don't know which disease. You start with the risk factor, you ask the questions, and you move forward. So watch my video on difference between case control and cohort. That's very important. Your concept should be extremely clear before you embark on a journey of writing your papers. Then you will enjoy research. Then you will love research. If you can differentiate between different kinds of studies, you will love research. Next, after this is clinical trials. Clinical trials are of two types: randomized control trial, non-randomized control trial. When you have two groups, it's called randomized control trial. When you have only one group, you call it non-randomized control trial. In randomized control trial, you did the sample selection. You do it randomly. You assign the intervention randomly. And in non-randomized, you don't do that. You choose the patient, so it can have bias. Randomly, you do it through computer software, or there are different mechanisms you can do that. So that's how clinical trial is done. And clinical trial, what do? We give a medication or vaccine or water or food. Anytime we give something to the patient, it's a clinical trial, and we look at the after effects of that intervention. So that's why clinical trial is also known as interventional study. Clinical trial is known as interventional study, and it is also known as experimental study. Clinical trial has three names: clinical trial, experimental study or experiment, and interventional study. So if you hear these any of these terminologies in a paper that this is an interventional study, you know it's a clinical trial. But you don't know if it's a randomized or non-randomized. So you will read the method section and they will tell you. That's it. So simple. So whenever we give something to the patient, it's a clinical trial, interventional study or experiment. And they are of two types: randomized, non-randomized. Just remember this for now. That's all you need. And then comes the review articles, the highest quality of evidence. What are the review articles? What review articles we have? Review articles are a combination of so many papers. You combine so many papers and write one paper out of it. So what are the review articles possibilities we have? Traditional review. Although traditional review should be at the bottom according to many experts, with ideas, opinions, editorial. But everyone unanimously agrees upon that systematic review and meta-analysis are number one. So review articles are of so many kinds: traditional review, scoping review, systematic review, meta-analysis, and then the umbrella review. That's it. These are the possible kinds of studies. And you will learn all different kinds of review articles in this training. You will find out how easy it is. Traditional review is written without any checklist. Systematic reviews and meta-analysis and scoping reviews are written with a checklist. In systematic reviews and meta-analysis, you will check the quality of the papers that you have included. That's what people were talking about in this when I started, about the quality appraisal. Quality check. In systematic reviews and meta-analysis, you have to check the quality of the papers you have included. You follow certain guidelines like PRISMA checklist, preferred reporting items for systematic review and meta-analysis. What else? And scoping review, you also follow checklist. You have inclusion exclusion criteria and scoping review, meta-analysis and systematic review. But in traditional review, you don't need to have a checklist or to write a paper or to do quality appraisal. You don't. You just write it like an essay. Systematic review, scoping review, and meta-analysis, you write it without. You write it with a checklist, and you have inclusion exclusion criteria. You check quality in systematic reviews and meta-analysis. And what's the difference between systematic review and meta-analysis? Remember, meta-analysis becomes a systematic review becomes a meta-analysis. Systematic review, when it becomes statistical, it becomes a meta-analysis. That's it. One step ahead of a systematic review. When it becomes statistical, you call it a meta-analysis. You don't call it a systematic review. That's it. And you will draw some special plot, like funnel plot, as one of the students was discussing here. That will be in the meta-analysis. So that's the difference. And you will learn this in the training. The only component you will not learn in this training is the statistical component of meta-analysis, and that's on purpose. I don't want you to get confused right now. Just write a systematic review and complete it and publish it without statistics for now. If you want to learn statistics for meta-analysis, you can enroll later into a meta-analysis course and learn that. But right now, the most important thing is to learn the basic concepts, improve your knowledge of research, and learn to write papers and write and publish a systematic review, because it is also number one highest quality of evidence. And then if you want to learn more, you want to expand your knowledge and want to learn meta-analysis, then we are here. So that's it. This is all about research, nothing else. And now, how many kinds of articles? Clinical trial, animal studies, all of these are original articles. We call them original articles. Now, Samia, your question. In vitro studies, you do empirical study, right? Animal studies, you do empirical study. Clinical trial with human beings, you call them empirical studies, right? Observational studies, all the observational studies are empirical studies you do in the lab or a hospital or in the field. So they are all empirical studies. So you call them original article. This is a terminology used by journals, original article. And the review articles are review articles. Some journals consider meta-analysis as an original article as well. And now, what about case report? Do we call it as original article? No, we call it a case report. Case study is known as case report. A written case study is known as case report. We don't call it an original article, or we don't call it as a review article. Now, the remaining are ideas, opinions, editorials. We call it idea article, opinion article, editorial articles, or the letter to the editor. That's it. There is no other kind of article left in this world that you should know at this stage. Review articles, original articles, case reports, and case series. Ideas, opinions, editorials, and letter to the editor. Congratulations. That's it. Everyone is clear now. Hopefully you guys now have a good concept before you start your training. Anyone has any questions? Any confusion now before I leave? It's time for me to leave now. Nobody has any question left? Can I leave now? Okay, guys, thank you. It was a pleasure to see you today. It was a wonderful session, and I hope you guys will enjoy this training. And now the concept is clear, and now wait for the announcement for the weekend, and we will begin your classes for all those who haven't started their classes yet. I'll introduce you to your mentor, and you guys will begin the training with full focus and motivation, and now you guys can enjoy. I hope nobody has any questions left and any confusion. If you have, just send me a text message and start watching my videos on difference between different kinds of studies, so that you grasp the concept and it becomes your subconscious knowledge. that you never forget it. Okay. Thank you guys. Pleasure talking with you. And we'll see you again very soon. I'll announce the date for another session very soon. Thank you. Have a good day.